Dr. Jaffe, are there different types of choline, and what are the differences, and which one do you recommend?
With regard to choline, it's either choline bitartrate or choline citrate. I urge and recommend the use of choline citrate. I would avoid choline bitartrate whenever possible, and it is possible. Now, why do you want choline citrate? Well, you want it because it enhances the uptake of magnesium, whereas choline bitartrate does not. Choline bitartrate, which is a source of choline, is not alkalinizing, is not energizing, and most importantly, it does not form a little inverted micellar nanodroplet, a little tiny droplet that can be taken up by the neutral pores when the normal ion channel for the uptake of magnesium, for example, is impaired or inhibited or deficient. So we want choline citrate, we don't want choline bitartrate. All choline bitartrate comes from corn, and you have some corn antigen in choline bitartrate, which for many people is a further immunotoxin. It's an immune provocative contaminant. So we want choline citrate. We want to avoid choline bitartrate. From a clinical standpoint, there are only two forms available: the cheap and the form to be avoided, which is inexpensive, called choline bitartrate, or the physiologically beneficial choline citrate, where the citrate not only helps with the formation of this nanodroplet, but also it alkalinizes and energizes the mitochondria, the cell battery, when it gets to the cell battery. So that's an added benefit. The choline helps with the chaperoning or the engaged delivery of the magnesium to the cells. And then when the choline gets to the cell, it's helpful because choline and inositol are part of the amplification system to various signals. So when a hormone or a neurochemical comes to the cell, its signal is transduced either with the help of magnesium and calcium or the help of choline and inositol. Actually, those pairs work together. And so it's very important to have the right form of choline, choline citrate, and from my clinical experience, to avoid the immunizing and unhelpful form, which is choline bitartrate.